my name is Alice Kershberg and I am the clinical nurse specialist for neurotrauma here at the Royal London Hospital. A typical day kind of in my life of the clinical nurse specialist is very varied. Most of the stuff I do is patient liaison and family liaison. Most clinical nurse specialists will spend most of their time with the patients. The majority of my patients either cannot communicate because of their traumatic brain injury, they may eventually be able to, but at the moment can't, or can't really advocate for themselves. I think when I started the job role, there was 3 points on my job description, and I don't think any of them are anything that I actually do anymore. Most of it is just kind of fixing, is what I kind of generally call it. And I feel that people can come to me kind of now, and I often say to them when I meet them, I will look after them from now until whenever. Brain injury is a real roller coaster, and I will often be really clear with people at the start. And there's some days that we're coming and the news is great, and other days we're coming and saying something like a simple chest infection has actually kind of really caused their relative to be really quite unwell. We often get accused of being quite overly positive, but I think, actually if you come in every single day to see somebody and you're constantly reiterating just how awful this is, they know, they're not stupid, it's their relative, they can see they're on intensive care with tubes and wires. But it's about those small wins. If you don't give people kind of the hope, that's the only thing that gets them up in the morning. It's the only thing that gets them to come back. And people never really know how they're going to cope in this kind of situation. And I think some of the people I've met are probably the strongest people I think I will ever meet. I think it's also made me really kind of rethink about what I thought success was. Again, working in A&E, it was success if someone left the A&E department and maybe made it to theatre or made it to the ward. I think we fixed a lot of people and we do amazing things, but we're not so great at that aftercare bit yet. And I think, what is kind of on a scan looks fantastic. You meet the person and they maybe haven't left their house, or their relationship's broken up, or just they're actually really, really miserable. And I think, what we celebrate sometimes needs to kind of change and have a little look at. We also set up a family support group, and that runs one Wednesday a month, and it's basically a chance for people to come together. And actually you watch the people who are a bit further down the line kind of impart knowledge and wisdom on other people, and you see that they get something from that, and I think it's kind of cathartic for everybody. I think getting kind of into the clinical nurse specialist role is difficult. I didn't do it in, I think, probably a way that most people did, but nursing is very much like that. In the medical career you spend a lot of time kind of learning. Nursing is very much kind of experience and learning on the job. But yeah, it's been fascinating, and I was interested in the brain beforehand, and now, it is just the most fascinating thing. And we're learning and we're changing. And because our patients are doing better, and people who are surviving now who wouldn't have survived 5-10 years ago, if not longer, we're having to change the way we think.
In a dark room we fight, make up for our love. I've been thinking about you, about us.